Hi, this is Eric Ruderman from Northwestern in Chicago, and I'm coming to you for Room Now from the last full day of ACR Convergence 2021. I've been looking at psoriatic arthritis abstracts all week, and today I wanted to highlight a really important pediatric psoriatic arthritis abstract that was presented at the plenary session yesterday. This is abstract 1424. It's the Juniper study, secukinumab in enthesitis-related arthritis or juvenile psoriatic arthritis. The pediatricians have had challenges over the years as they don't have as many options for their kids as we do for our adult patients. And interestingly, actually, at this very same meeting, there's a poster 249 on the 10-year results of etanercept in pediatric psoriatic arthritis. So they've had biologics, but they haven't had anything other than TNF inhibitors. And it's really nice to see good data with other mechanisms in the pediatric population. This particular study was run much like a lot of the other pediatric studies in which all the kids got active drug initially, and then those kids who responded were randomized to stay on active drug or switch to placebo. They do this that way because that minimizes the amount of time that a kid may be on placebo and not be actively treated. This study looked at 86 kids with either enthesitis-related arthritis, which is essentially juvenile spondyloarthritis, or juvenile psoriatic arthritis. And the highlights were that all of these kids either currently or previously had some enthesitis, which is a major feature of both of those diagnoses. They were treated with open-label secukinumab weekly for 5 weeks with a dosing based on weight. And then they got another dose at the 8-week time point. And then at 12 weeks, those kids who were doing well, who had responded with a JIA ACR 30 response, which is a joint response, 87% of those kids were then randomized to switch to placebo or stay on the secukinumab in a blinded fashion. And the primary endpoint was time to flare after randomization. And there was a dramatic difference between the secukinumab group and the placebo group, with the placebo group having a median time to flare after randomization of just over a year. The secukinumab group didn't even hit a median time because they kept responding. Safety data was very consistent with the safety of secukinumab in adults. And so I think that the key point of the study, which was initially presented as a late breaker at EULAR last summer, but this is the first time that many in the US audience are seeing it. The key takeaway from the study is that it's really nice to see good data with another mechanism of action in these children with pediatric psoriatic arthritis, as well as the spondyloarthritis. This data will presumably help them as it gets into the label, getting approval for these drugs for kids. And hopefully this is just the first of additional data to come, looking at other mechanisms so that they're not limited to one target in these pediatric patients. That's it for me for ACR Convergence 2021, but check out roomnow.com for lots more information about this meeting, lots of interesting insights about the data presented.